News first tonight, some harrowing news for parents of newborns. A staffer from the Guam Hospital's nursery unit recently discovered they had active tuberculosis, placing over 300 infants in direct contact with the infectious disease. PNC's Rebecca Elmore spoke with GMH CEO Peter John Camacho and Public Health Director Jim Gillen, who explained their next steps to keep the disease from potentially further spreading.
Say hi! If you're a parent of a newborn who just visited the Guam Memorial Hospital, you might want to check yourself and your newborn back in.
We got confirmation that one of our staff, who was working in the nursery area, had active TB.
The staffer who unknowingly carried active TB potentially exposed the infectious disease to over 300 newborns at the hospital. But it's not just the infants at risk.
We are also screening the employees as well in that area so that we can make sure that everybody is going to be accounted for.
But just because your infant may have been exposed does not necessarily mean that they're immediately infected.
You have to be careful about making the distinction between a case and a contact, okay? The case, as Peter John said, is the index case is the one that worked in a nursery, okay? Now this was also a person who was not symptomatic, showed no indications that they had any tuberculosis.
In fact, Public Health Director James Gillen says the individual unknowingly carried the disease until an executive checkup revealed something was off.
So all the time the person was employed, there were no indications.
And to make matters worse, Gillen says TB screenings aren't that reliable to begin with.
The thing that's problematic about TB is that you can have latent TB. You can I probably test positive just because I've been in a building that has had people with positive TB. It doesn't mean I'm going to have active tuberculosis. One of the things about these kind of mass screenings, okay, that occur is that the screening tool itself, the PPD, sometimes can give you a false negative.
But for the parents who are wondering what is being done in this particular instance, Camacho says they have a task force comprised of TB specialists and skilled physicians who will work to get all the affected individuals screened.
It's going to be expensive.
It's going to be expensive. But, these babies are our future.
Reporting for PNC News, I'm Rebecca Elmore.